Hi, I am Xiao Ting. Welcome to another episode of our CMS MedTech tutorial series. For this episode, we are going to go through the specific steps on how to compile a common submission dossier template, also known as the CSDT. But what is the purpose of the CSDT exactly? In short, it is a particular format recognized by the ASEAN authorities for organizing medical device technical documents for the purpose of regulatory submission. After the CSDT is approved, the manufacturer may continue to supply the medical device in the respective ASEAN countries. If you do happen to see the CSDT before, then you might have spotted a high level of similarities between the EU technical file and the CSDT. But I would like to highlight the main difference between the two. The technical file needs to be maintained and updated throughout the entire lifetime of the medical device. The technical file is subjected to audit on an annual basis by the notified body to ensure the medical device continue to remain under C certification, which in turn enable the medical device to be supplied in EU regions continuously. The manufacturer also needs to maintain one set of technical file for one group of medical device only. The CSDT, however, is actually more like an application form. Once the CSDT is submitted and approved, there is no need to maintain it anymore. Further changes to the medical device, if any, would be notified to the ASEAN authorities through other means, as stipulated by each ASEAN authority respectively. Also, the CSDT formats among ASEAN countries are not harmonized yet, unlike the EU technical file. This means you need to submit one set of CSDT to, say, a country in Singapore to gain regulatory approval, but you would need to submit a different CSDT format to another country, say Vietnam. Hence, it could somewhat be deduced that the purpose of the CSDT is only to align the terminology of the requirements among ASEAN countries. Regardless, it is always beneficial to learn the format of the CSDT in general, as the requirements among ASEAN are still similar, although not 100% identical. As such, we would use the Singapore CSDT format as material today to explain the CSDT requirements. We would use an orthopedic implant to illustrate this. The first thing to note is that we are going to split the CSDT into two parts. The first part is the executive summary, whereby the objective is to give the reader a good general idea what the medical device is about. This is indicated by the prefix number 1 in the heading number. The second part is the elements of the CSDT, so to speak. This section would bring the reader through the specific details on the device in question. This is indicated by the prefix number 2 in the heading number. The first step is to create the overview. You need to indicate the introductory descriptive information on the medical device here. You also need to indicate the intended use here, the indication for use here, and any novel features here. The second step is to indicate the commercial marketing history. You need to indicate the list of countries from HSA's reference regulatory agency jurisdictions where the medical device is marketed here. Currently, the Singapore HSA recognizes the US, EU, Australia, Japan and Canada as the reference agencies only. You need to indicate the date and country where the device was first introduced for commercial distribution, globally, in the format below. You would also need to provide the market history declaration in the annex. The market history declaration could be obtained from HSA website. The third step is to provide the list of regulatory approval or marketing clearance obtained from recognized agency. You have to provide the reference approval in the annex, and also you have to provide a declaration whether the labeling, packaging and IFU of the product intended for sale in Singapore is identical to the product approved in the reference agency's country. The fourth step is to provide a summary of reported adverse events and field safety corrective actions. You would need to provide the root cause analysis and corrective or preventive actions for any open FSCAs. This would conclude the first part of this tutorial. Please stay tuned for part 2 of our CSDT tutorial. We hope that you find this tutorial useful, and please contact us at info@cmsmedtech.com if you need more information.